Mobio Interactive is precision psychiatry at scale. What we're really doing is we're releasing the tension that has historically existed between the ability to personalize and the ability to deliver psychiatry at scale.
Moving to personalized health, and that includes things on the treatment side to personalized medicine, and it includes ways of integrating technology to bridge to the last mile of care, which is one of the hardest challenges that exists in private health and public health. When we're talking about new areas of interventions, what you need is an ecosystem of change. It starts first with being able to identify a target population of individuals who have needs for and are receptive to better care, have a set of clinicians who are embracing new models, who look at what we've done in the past isn't enough, and they're open and willing to be able to try things out with, of course, with evidence behind it. And then the third is being able to have the tools that are able to then scale and go across this new change that's happening in transformation of healthcare.
CHEO is leveraging the Mobio platform in different ways. So we are using OmniTX as a psychotherapy preparation tool. So patients who are roughly a month away from entering into a program are given access to the OmniTX platform in the hopes that this will kind of prime them for their clinical treatment while also providing them with critical resilience training. Now, we're also using the MI platform, so the Mobio platform, for other research, one of which is being used or conducted in an acute concussion population. The goal here is to increase resiliency and teach these children how to manage their stress and symptoms, so pain symptoms and emotional symptoms, in order to prevent rates of persistent post-concussive symptoms.
We think digital therapeutics has the potential to remediate or address that massive disparity in supply and demand for services, as well as providing evidence-based care.
Providing people a self-guided tool that can actually teach them some really great skills to, be more mindful, regulate their emotions. And so we hope that that will keep them engaged while they're waiting for something. And then as they get into their program that they've been referred to, that they'll hopefully continue using it as well.
In particular, we use computer vision and AI to measure how a patient is doing as we deliver therapy for them. We really have two expectations. One is that the base platform that we call OmniTX, it is able to support patients by giving them resilience tools and the ability to measure how they're doing it in an objective way and compare that to their own assessment. The second expectation is for us to be able to deliver actual treatment, and those are our clinical interventions that are unlocked on top of this base platform. And in that case, we're looking at first-line treatment for traumatic brain injury in kids, for example. When it comes to the prescribed interventions, they all come out in the same platform. So we have that nice infrastructure, which enables us to reach a lot of patients in an efficient way.
1 in 5 children and youth have a mental disorder, and 80% of adult cases have its roots in childhood.
What we want to do is to be able to have technologies which allow us to, number one, quantify what the issue is. Number two, be able to identify which interventions are most helpful to individuals by categorizing mental health challenges in a way that's addressable based on tool sets today versus tool sets tomorrow. And three, help support R&D so that the R&D in the future can start to be able to address this wave of the unknown.
OmniTX's library of psychotherapy sessions totals 175 hours of clinically validated therapy in 6 languages. We test OmniTX's treatments by partnering with leading clinicians and researchers around the world to rigorously investigate the efficacy of the therapies inside of the app. And we do this by conducting randomized controlled studies, controlling for placebo. And the results so far have shown that OmniTX is delivering meaningful therapy to patients around the world.
The potential of the Mobio Interactive platform is that people can sort of do something that will help their mental well-being while also feedback information to clinicians. And so we hope to sort of break down that barrier where, we have to continuously ask our patients to do something. But I think the interesting part about this type of platform is it automatically kind of generates some of that information for us. And if we can find a way to loop that back into our, electronic health system in some way, it would really help us clinicians understand how that person is doing without having to subjectively ask them every week or every 2 days, or we bother them a lot for this information.
The biggest achievement that the company has done to date is really being able to prove that all of our tools that we've built up in order to deliver precision psychiatry at scale actually works.